Okay, so now we're going to start going into some of our side bridging and our lateral line exercises in here. Okay, so let's just start from a very basic, easy position. Knees bent. Most of our patients can do this. I love this for patients because so often we're working patients in a sagittal plane and we don't get the other planes in here. Then if they can do that now, of course, we just go to knees extended. Let's bring that back here. Now knees extended. Sometimes when they're doing this in this position with the shoulder, one of the things is I will let some people kind of roll a little bit so that humeral head is centrated a little bit and they don't get as much pressure in the labrum if they've had any previous injuries. Okay, and once again, during the side bridge exercise, which side are you activating? The downside, but the upside is still getting significant activation. So yes, it's the downside, but you're getting just a great workout throughout the core with these side exercises. Now we're going to do a bit more of a roll now. So now we're going to try and keep that plank going, but now we're going to roll the body in here to work that stability. So just a simple core roll. See how that feels? You're going to feel it, especially on that downside now, trying to keep that plank position. And then we're going to do a side bridge roll. So now we're going to transfer position. Now in here, what we're trying to do is we're trying to see if the body can stay as one side. You can see she kind of moved that hip a little bit quicker in there. Let's just go back to here for a second. You want to see if she can keep the whole plank when she does her position transfer. So she's still finishing the core roll here. Now she comes up, and now can she do the whole thing? That side not too bad, but when she goes to this side, she's leading with the hip a little bit more. So we'd like to clean that up. Okay, now we can start doing stability. Now we start talking about some more mobility exercises. So this is a favorite of mine. I love doing the hip abduction one. This will really take right in here, the glute stabilizing muscles in here. You're really going to feel it now, and you'll feel it in the hip coming up. And these are the mountain climbers. Now, one of the things to keep in mind when I talk about progressions, it doesn't necessarily mean, okay, you go to the side bridge roll, that this is a progression of how hard it is. This is almost like a menu that you can choose from, because I know a lot of people find the mountain climber easier to do than the hip abduction exercise in this plank position. So sometimes you'll jump from one to the other. You're not just going to go just straight down the line and say, okay, I have to go from here. You may find the side bridge from the knees, you're not even going to go. You're going to go straight to with the knees extended, and maybe from there you'll want to go to the hip abduction. Now we're going to talk in the gym. For those of you interested, believe it or not, this is my high school, neighborhood high school, Burnsville High School. This is their lifting gym. They're very big on lifting, Olympic, and power. But now we can start adding some weights to it. And now we'll just start doing some abduction in there. You can start with a light weight. See if she can keep that plank throughout, focusing on the scapular movement with this. Okay, now from there, if you want, what we can do, we can go with the elbow extended. One of the things we do is when we talk about doing these exercises, especially with this is an active contact where they're really pushing their hand in, activating those lats to try and get some good stability in here. So you can almost add any exercise to this in the plank position if you wanted to make it a little bit tougher. You can use some elastic bands if you wanted to do something like that. And now here's the thing, what about some people who have problems with their shoulders? They really can't go up on their shoulders, and that seems to bother them a little bit more. Well, one of the things we can do then is we can just raise the legs, do an elevated. And if you do that, now you can see I've put an RX pad. One of the things I found is when I do this, sometimes I use a surface like this. Even benches sometimes can be a little bit tough on the feet or the ankles, so I'll use an RX pad. So now she'll just do feet elevated. And this is a great workout. You see, she is not coming up that high. But this really is just a wonderful workout in there. Once again, this is one of those things this is tough on the side. So you may find that people get a better workout with this than they would with something like just a simple hip abduction or knees extended, even though it's in the progression. But you may not be able to do it because it may be too hard. So once again, you're taking into account what's their shoulder like, where do you want to bring them? And now you can, of course, go into the gym. You can go on to the 45-degree. I really like this coming it down slowly for that eccentric component on the upside. Works very well. I prefer this over, a lot of times you'll see the side bends with dumbbells in the gym. I kind of prefer this over that.